I am Dr. Sharjeel and you are watching my YouTube channel. Now this is very important video with a take home message. Today I was sitting in my clinic and a father rushed with his 10 years old daughter who was crying with pain. Her eyes were closed with the yellow secretions. I asked the father what happened to her eyes, and he said that yesterday night kid was playing outside home and there was lime lying near a wall in the street, and one kid threw that lime into her eyes. And after that we tried to clear it, but her condition worsened and now the eyes are unable to open. Now hearing about the lime is an alarming sign, as we have pre-existing knowledge about chemical injuries to the eyes that acid instillation is better and safer than alkali instillation into the eyes, because acids are stopped superficially, whereas alkalis they penetrate deeper, causes more damage and permanent damage to the eyes. Now there are two types of alkalis, strong alkalis and weak. Unfortunately, lime comes in a strong category, calcium oxide and calcium hydroxide. Now it is usually used here to paint walls, but it should be covered and it should not be left casually in the streets, because accidents can happen like this one. Now let's come to the case. I tried to open the eyes in my outdoor, but lashes and lids were stuck with secretions and chemicals, and patient was in pain. So as it's one of the ocular emergencies, the chemical injury, I took her to OT, give her sedative syrup, moistened the lashes with the topical anesthetic, put normal saline to lose the adhesions of the lids, applied the lid speculum after gently opening the lids, and I saw left cornea was fortunately clear, and I found a few concentrated chunks of lime in the left eye furnaces, irrigated the eye, removed all the visible lime debris with corneal forceps. When I proceeded to the right eye, the picture was not good. Cornea was opaque, as you can see. I have shown right eye cornea with lot of lime crystals present in all over the conjunctiva in furnaces. I patiently removed all the visible lime, irrigated the eye again and again. Whenever you encounter a chemical injury, you should remember the rule: irrigate, irrigate and irrigate. One assistant was pouring topical anesthetic. Patient was definitely in pain because I was performing it in topical anesthesia. Whole night strong alkali had penetrated the eye deep, so pH was strongly alkaline. Ideally you should have a litmus paper, and while irrigating the eye you check the pH until it becomes neutral, but here I didn't have a litmus paper, so I removed all the visible chemical, and you can see the white cornea, opaque cornea, congested conjunctiva, but there is a limbal ischemia 360 degree as well. Fortunately I had freshly prepared amniotic membrane, so I put AMG piece as a bandage contact lens, and it will also decrease inflammation and absorb the alkali, and patched it for one day and started on. started on artificial tears. The best is to use preservative free artificial tears 1 hourly, and ointment or gel at night, and also I added antibiotic drops and mild steroids like fluoromethalones. So I'll follow her, and I will share her follow-up picture of the right eye in which there is limbal ischemia and opaque cornea, that whether it recovers or not from this serious Lyme injury. And take home message is that you have practically seen how much damage the Lyme, the alkali injury can cause to the eyes. So we should keep these strong chemicals out of reach of the kids, and we should also keep a watch on our kids, that what they are playing with things they are playing, and the environment in which they are playing, is it safe or not. Thank you very much.